Okay, this is Mr. Fernando. He had his first back surgery about 8 years ago. He's had three, and you can see the scar. Um, I've been working on him for 5 or 6 years. How many years? About 6 or 7?
Yeah, 6 to 7.
And he comes in when his back tightens up on him. This is how I've decided to treat him. This is worth about 150 pounds worth of effort. So what I do is I do wet needling, and I use short needles, medium-sized needles, and to get really down to his glutes, I use the long needle. And you basically work on all of this area because it's all involved. It's all muscle. So right now I'm working on his paraspinous muscles. And what I do is that's the edge of it, that's the center, and I just work in here. And basically I just go and I poke around. You okay, mister?
Yeah, I'm fine.
Okay. And then I put in a little numbing as I go. And I don't discriminate. I just do the whole muscle up and down. The mechanism of action is stimulation. So, oh, there's a good spot right there. Now, as I'm doing this, I can feel the tightness of the muscle turn into butter. And the goal is to get the muscle to relax, to unleash, to release, and so then you can stretch out the muscle. If the muscle is too tight, just like a tight fist, it can't heal because it's too tight. You have to heat, stretch, needle. Heat, stretch, needle. Heat, and don't really discriminate. So this is so I'm going to get this side over here. You okay?
Yeah, I'm fine.
Okay. So I put in a little bit of lidocaine as I'm going in, so his eyeballs doesn't pop out. And then I just stimulate. If you put the needle in and just leave it there, that's okay. But your mission is to stir. You have to stimulate. That's the mechanism of action. If you don't stimulate, nothing can happen. If you're stirring a pot of gumbo, oop, that was a kick there. If you're stirring a pot of gumbo and you don't really get all the way down to the bottom, it's not going to cook well. So what I'm going to do is I'm going to aim this all the way down until I tap the bone. You can see how deep that is, and I haven't gotten there yet. You okay?
Yeah, I'm fine.
And most of this they can't feel. Oh, there's a give right there. And what I'm doing is I'm feeling as I'm needling. The evidence is at your fingertips. It's not what you see, it's what you feel. It's what he feels. What you see is just a reflection of what is going on in here. Those meridians are valuable, but feel is much more valuable. And I've already cleaned this off. So what I'm going to do is, this is hard as a rock right there. And I'm not sure if a plate is in there or not. But you can see how that center and then this one center is a little bit farther out. So this muscle is really locked up. Now, all this is circumstantial, but the evidence is there. What do? You just treat it until the evidence proves itself or disproves itself. If you never try, you'll never see. If you never needle, you'll never know. If you never touch, you'll never find out. And you have to needle all the way down to the bottom of the pot, or you'll never, or you may not ever be able to help someone out of pain. That little bit at the bottom of the pot could be the difference between freedom and misery. You're obligated to reach as far down as you possibly can. So what I'm going to do is, I've done this before, and the needle never, let me get right in here, it always stops right in here. I can never, okay, it's going in now. You can see how it's bending. Oh, there it goes. You okay?
Yeah, I'm fine.
I'm pulling it back up. You can see how it catches, and the needle flips back straight. It bends. There it goes. So I'm marching the needle underneath, fanning. So I go in one spot and then I fan, and I can move it like that, but you gotta make sure it doesn't get caught on the tissue. And then you can get the point up, and then you can redirect it anywhere you want it to go. So one insertion, then you can work on this whole area. And now I'm going to use, and he rarely bleeds because the muscles lock. The muscles lock. As soon as you pull the needle out, the muscles lock up, and it stops the, it tamponades. So if you don't stimulate enough, there is no blood flow and nothing will happen. So he's complaining about this one, this side, so I'm going to go all the way down to the bench. You okay?
Yeah, I'm fine.
Now the sciatic nerve is right here, so I'm way in the safe area. So I'm going to redirect this. Oop, you okay?
No, I'm fine.
Nothing. You see how deep it is. I'm going to angle it. You okay?
Yeah, it's fine.
Okay. Let me pull this. There it is. That's the bone. Did you feel that? Didn't
A little
really.
bit, just a little bit.
Now you're going to be sore,
Uh-huh.
but I need you to stretch
Okay.
and heat it, stretch it, massage it, heat it, stretch it.
Okay.
We decided 5 times a day for your stretching,
Okay.
and do your walking, do your stretching, and once you go through a healing cycle, give me a call and find out how much better you are, and then we'll go from there.
Okay.
Okay, thanks.